Welcome to the New England Journal of Medicine at the annual meeting of the European Society of Cardiology. I'm Stephen Morrissey, Executive Managing Editor, and I'm talking with Deputy Editor Jane Leopold and Editor-in-Chief Eric Rubin. We're looking at the Palisade trial, Plozasiran for managing persistent chylomicronemia and pancreatitis risk. So Jane, we're going to ask you to be a gastroenterologist. What's this study about?
So this is a study that's looking at an siRNA, Plozasiran, and how it can be used to manage patients who have persistent chylomicronemia, so markedly elevated levels of triglycerides, who are at increased risk for pancreatitis.
And Eric, how was it conducted?
Steve, in this study, the investigators randomized patients with chylomicronemia, with or without a genetic diagnosis underlying it, to receive one of two doses of Plozasiran or placebo. The primary endpoint was a median change in fasting triglycerides from baseline to month 10. Importantly, one of the secondary endpoints was the incidence of acute pancreatitis. There were 25 participants in each group. Plozasiran lowered the level of triglycerides by more than 50% at both dose levels. The investigators also saw fewer episodes of pancreatitis, with the incidence dropping from 20% in those receiving placebo to 4% in the pooled Plozasiran groups, though the numbers were quite small.
Jane, how important is this decrease in episodes of pancreatitis?
This is actually a very important finding in this study. And while there have been other studies of similar agents that have seen a decrease in the number of episodes of pancreatitis, this is actually the first time it was able to be tested statistically and showed that there was a significant decrease. So considering the morbidity associated with pancreatitis, this is actually a very big finding.
Jane, I know this agent's been looked at before. What are the effects of Plozasiran on cardiac risk?
Well, so that's an interesting question because while it does lower the risk of triglycerides and it drops it to about 50%, we have data from other studies that showed that decreasing triglycerides didn't actually change cardiovascular risk. So what we need to do is really find out how low do we need to drive the triglycerides, and is there something else about this agent that will help modify cardiovascular risk? This isn't what this particular study looked at, but it is promising, and we look forward to hearing more about it.
Thank you, Jane, and thank you, Eric. This study was just published at NEJM.org.